Act like you got some balance, or these are things that it can't be controlled. It is a chemical disorder. It is a mental disorder. They need help. They need your understanding. They don't need to be called crazy. They don't need to be going to a psychiatrist. They need a psychologist. They need to initially be diagnosed by a psychiatrist. They need a psychologist. They need possibly to be on medication and to go for psychotherapy in order to stay in balance. I mean, I just don't understand. I don't want to be on anything. I don't want to be drugged up. Well, who's to say you're going to be drugged up? If you feel drugged up, if you act drugged up, if you look drugged up, then maybe you're on the wrong medication or the wrong dose. But the reality is, if you want to function normally, have a normal life, not be miserable, not be upset all the time, not be crying, not be exhausted because you're manic, I'd rather take a pill and live a normal life than be manic and exhausted and depressive and all of those things. So if what I'm saying sounds familiar to y'all, grab a family member, grab somebody in love and say, listen, such and such, I was listening to Doc and the stuff she's saying kind of sounds like A, B, C, D, and E. Patients with ADHD can also look like bipolar patients, and generally when in the system, because you do have some sick people out there who are real excited about their kids being diagnosed with ADHD because it brings a check every month. Yeah, well, the problem with that is once they're logged in the system as ADHD, once they become adults, that diagnosis automatically essentially switches to bipolar disorder. So they're labeled from the time they're 6 or 7. Hope you're enjoying that check. Okay. And so the reality of the situation is that we have to stop this nonsense of, ignoring and hating mental health issues in the African American community, because it is getting, society is crazy, as we know, and it is getting more, and more apparent. And it's affecting our children, and our children are having children younger, and it's affecting their children, and we just all really need to stand in solidarity and help each other. This is no joke, but for me to see, a patient yesterday say, well, my grandma told me to try and control it, that's just hurtful, because it's her grandma. She loves her grandma, and her grandma speaks in wisdom like most of our grandmothers speak, and she's just telling her the best she knows. But that's the thing, we got to learn better, we got to do better, because if this patient goes on to potentially have a depressive episode where she harms herself, then what do we all say? I didn't see it coming. I didn't know. I mean, she was a little bit sad, but it's just everyday stuff, just the same as everybody else's. If people who love you are telling you things, listen to them. Listen to them and get help as a family. If you want to keep it private, but get help as a family. Okay. All right. So this is Dr. Tosha, about to start my work day. They're knocking on my office door. Keeping it real and uncensored. This is straight up. This is not meant to be funny. This is on a real. This is hoping I reach somebody with this, so you can reach somebody and y'all can all watch the video together and y'all can all go get some help, whatever the case may be. But I'm hoping I reach somebody with this on today. But I gotta get my Tuesday popping. All right, so I'm out.